CIAC is very appreciative of the opportunity that we had to meet with DPH and representative of Governor Lamont's office today. They were very generous with their time. We had the ability to hear from them where we are in terms of COVID in the state right now, as well as how that is playing out with our schools, and just thoughts about how that impacts sport experiences for our kids. From CIAC's perspective, we are pleased that we had the opportunity to speak in person to them about the mitigating strategies that we're putting in place. Sometimes having those conversations and being able to dialogue through those strategies give a better understanding of what we're attempting to do to mitigate the spread of COVID in athletic experiences. So with that, they do have new strategies, particularly for the sport of football, that we gave them today. So they will be looking at that and doing their best to get back to us in the short term. They did express they understand the urgency of this, so we look forward to hearing back from the Department of Health, and they're just very grateful for the opportunity we had to speak in depth and in detail with their experts today.
You remain unresolved on this issue of whether or not football is going ahead in the fall, so that's still unresolved.
I'm sorry, I didn't hear you.
Paul Hughes from Republican American. So the upshot is there's no decision on whether football will proceed in the fall at this time.
At this time, we have presented additional mitigating strategies and new things that the department is going to consider in that. When we get the feedback from them, it will give CIAC, again, more information in terms of recommendations for the decision that we have to make of whether or not we could move forward with football.
Glenn, can you talk about what some of those new mitigating strategies are?
Very specifically, we talked today about some ideas for face shields, for face masks. We talked more about the number of people that potentially would be on the sideline. Previously we talked about reducing the number, but we actually try to put some numbers to that today of what may actually be on there. We had a lot of discussions today about how impact in terms of a collision sport like football, differs from contact sports as well. So, those were good conversations that we had today. Beyond that, talking about things like, sanitation methods, spacing out, not only when you're on the field to play, but when you're on the sidelines, trying to catch your breath, and you had that wrong run. Now you come out, and how do you keep things safe on the sidelines as well? So again, I think we presented quite a few new things to them today, and want to give them the time to review that. But again, they understand the urgency, and I think we'll hear from them in the near future.
Do you think by Monday, perhaps, or sometime over the weekend?
I think they'll get that to us as quick as they can, understanding that there are other public health issues that we're dealing with right now. So we need to be respectful, but all sides, CIAC, the Department of Health, the representative for Governor's Lamont office, we're all very aware and all on the same page that our student athletes, our coaches, deserve a definitive answer and direction of where we're going in the fall.
Did you discuss how receptive they were to these ideas, and whether or not there will be some flexibility with what they previously had discussed?
The Department of Health has been receptive throughout the process. Again, I don't think that there's a point in time where between CIAC and the Department of Health that there was ever an adversarial type of relationship there. So they were as receptive today as they've always been. I think they're going to. I think what was of value today was being able to have our doctors answer direct questions for the commissioner, and us to ask direct questions of their medical experts and of Commissioner Gifford themselves. Primarily it's been written document that's coming from us, and a written feedback that's coming from them. So I think having those medical experts together to have that discussion is what really gave more depth to the considerations right now.
Well, and if they come back and they say, we're open to the spring, as they suggested in their letter August 13th, either cancel or spring. I know the CIAC has said no, we wouldn't play football in the spring. Would you be open to reconsidering?
Yeah, you know, our decision on the spring is based on what we know right now. And, you know, again, as CIAC looks at the spring, we're a member-driven organization. There are pathways for membership to bring discussions back to the Board of Education, back to the Board of Control. What I think is, you know, is important from the board's perspective of the action that they took right now in canceling is, again, there's so many unknowns moving forward. Not just saying that, you know, we don't know in the spring what the metric or the climate will be like, but also, you know, we don't know from, you know, today to October 1st exactly where the metrics are going. We do know some schools in Connecticut have had to shut down. There's been some COVID cases, right? So we don't know what other sports will be impacted. We don't know what winter sports will get off the ground. So if you were to make a decision to move football to a defined period of time in whether it's early next year or in the spring, you're doing that without the knowledge of what's happening with other sports, as well as without the knowledge of what is the climate, the COVID climate, actually going to be like at that time. So I do think it's responsible of the CIAC Board of Control to have more information before they reconsider anything in terms of in the spring with football or any other sport.
Glenn, did they convey to you why they have described football as high risk, or was it mostly your side talking to them about your position?
I think all along we've agreed that football is high risk. There's CIAC, DPH, the National Federations of High School, the NCAA, the U.S. Olympic. I think we've all been on the same page. Football is high risk. There's no question that football is high risk. The question is, for when you look at the sport of football, you're looking at high contact, you're looking at collision, you're looking at kids, in close proximity. So when you look at the respiratory spread from CIAC standpoint, and our understanding of the National Federation and their explanations and the NCAA's, we're looking at, are there strategies we can put in place that mitigate that risk and lessen that risk? So, I don't know that there's anything that you can do that would change a high-risk collision sport from not being a high-risk collision sport, but I think hopefully what we are presenting are strategies that significantly reduce that risk and inform people. And that's, even right now what's being played in youth sports across the state. I think you're informing people so they can make educated decisions on whether or not they feel it's appropriate to go play. As long as COVID is with us and we're in a pandemic, there is a risk that you can never mitigate. Right? We can't stop COVID. We can only try to mitigate the factors that may potentially lead to a spread.
So then in that case, if there's no dispute that football is high risk and they're not going to change that categorization, what exactly are you hoping that they will do or say?
I think the question is looking to, are the strategies that we're presenting, is there recognition that these strategies do seek to mitigate the risk? And, again, that's where we're looking for the feedback on the strategies that we presented, and just to hear back on that, to see are there strategies that we're presenting that would reduce the risk? Again, we don't want to put kids in harm's way either. So having the information from the Department of Health and from the health experts is very important to us, and having our doctors be able to speak to them and listen to the conversation between amongst the medical professionals of what may or may not reduce, of what has scientific backing to it, what doesn't right now. That's why they're the experts in those things, and we're very appreciative of having the opportunity to present and learn.
So are you expecting some sort of thumbs up or thumbs down, or are you just expecting this suggestion looks good, this one doesn't look good, et cetera, make your own decision?
Right now we're just expecting feedback. Yeah.
Ultimately, if there is a decision made to go ahead with a fall season or even a spring season, doesn't the decision on whether or not teams will play come down to individual leagues and individual school districts, and even getting to like the superintendent and board level? Won't it then become a sort of a school by school decision whether or not to participate in this sport?
I think it ultimately, will come. I think we're seeing that play out now, right? We've seen some school districts that have said, listen, regardless of, kind of where this lands, we've made a decision, we're not going to play football, or we've made the decision, we're only going to offer, conditioning, moderate risk activities. I think even further than that, the decision ultimately, as well comes down to just individual choice with players, with parents, and what their comfort level is. And from that standpoint, I think it's our responsibility to educate people as much as possible on the risks and on the mitigating strategies to reduce those risks. So other entities could make that informed decision, whether it's an individual student and parent, a superintendent, a board of ed, or us. Our responsibility is, I think, educate them and then give our guidance and direction.
Would it be helpful to have a meeting with the governor at some point, do you think, between representatives of your organization and the school systems and the governor?
I was extremely pleased with today's meeting. There was representation from the governor's office that, which is exceptional today. The Commissioner Gifford, Commissioner Lehman in the meeting today. I can't ask more of them than what they gave us today. And from the governor's office as well. I mean, we certainly take the extensive amount of time that Mr. Mounds spent with us today as true, sincere representation of Governor Lamont's interest in having us come to a conclusion on this.
And did you guys point out to them, hey, look, youth sports were allowed to continue over the summer. On my way home, I can see the junior football league in my town practicing in a park. So they're going forward. I mean, was any of those kind of points made from your side, and what was, if so, what was any kind of response that you got from DPH and the governor's speaker?
Yeah, the majority of the agenda today was really focused on the mitigating strategies that CIAC is presenting in terms of football, and that was the primary focus today. That's really for us, for CIAC. That's the one outstanding, kind of sport that we have right now. We did talk a little bit more about volleyball as well. The idea of wearing a mask indoors to just have a little bit more direction on that. But that's really the focus is really on CIAC at this point, and concern of our sports, not necessarily what others are doing.
Can you talk about the superintendents of schools, the school systems in general terms, without naming them, approximately how many school systems there are that have expressed to CAST CIAC that they would be out if football is played this fall?
Yeah, we've had several that have expressed that they're out. We've had more express that, if there's a difference of opinion, that they would likely go with DPH's recommendations. On the flip side of that, we've had superintendents and boards of education that have reached out and have said, listen, in our local area, in our Department of Health, they think it's okay to play, and we'd like an opportunity to go ahead and play. We've also heard that there are some clubs for high school age kids that are forming in terms of football to really kind of centered more on the elite kid who maybe would be a scholarship athlete, to have an opportunity if there's not one through CIAC, to have an opportunity through another avenue similar to the hockey and the other things that are going on right now. So unfortunately, I think that the difference of opinion on this, as well as a lot of things around COVID, there's no consensus that everybody's going to agree on, right? So we've heard opinions on all sides, that we can't play, we are going to play, to we'd like to, but we're going to follow the department's recommendations to you should just go and play, and we'll follow you. So it's trying to come up with a balanced option and plan that provides as much opportunity as possible, and really we just have to keep educating people, so whatever choice they make, is being made in the best interest of their kid and with the most knowledge behind that.
When does a decision have to be made, in your view, so that schools, coaches, players, parents, and for your scheduling purposes for games, when does that have to be made?
Yeah. Would have been nice 2 weeks ago, and would have been nice for our kids, and that's where we all feel the most. I saw an interview that I think was done at the Wilton Library yesterday with I think it was yesterday, or it was posted yesterday, with 4 athletes from around that area. And just listening to the emotion of those kids and seeing where they are right now. That's the piece that, again, for us, we want to give the kids. That's the piece where, at least for me, personally, that I want to try to give them and feel that, that is probably, the spot where I wish that we were able to come to that sooner for them. That being said, we have worked tirelessly throughout this to get our kids back on July 6th, to get our kids back into those conditioning activities. We do think we have a safe product to engage kids. So, as we move forward, we want it to be as soon as possible. Our plan for next week is still to be in those small cohorts, but our plan for September 21st, a week from now, is that we're in full team activities. So we're starting to run out for football on the amount of time that is necessary for kids to properly be conditioned and acclimated to heat and to the other elements of wearing pads and equipment and everything else to safely play the game. It is, and that's, I'm going to say that's our responsibility, that we have to use the information we have, whatever it is at that time, to make the most informed decision CIAC can to give kids that final direction. And we are intent on doing that, and we're trying to, as you see now, just get the most information that we can to make an informed decision.
The last few days, the state has seen a few more COVID cases at a little bit higher of a rate. A bunch of schools, as they've gone back, have had a few cases. Could you imagine changing your stance based on what's happening in the broader state, or based on what's happening in schools?
Yeah, I mean, our plan, I think, one of the kind of running themes here is a fluid supercut. I think, Sean Patrick Bully had mentioned at some point, and that's our plan is fluid, and our plan is always looked at what are the metrics, what are the mitigating factors, how does that play into decision making. And again, if you take it back to March, I think CIAC has a proven record that if the metrics change, and if the science and the information tells us the safest thing to do is to shut down, we will shut down. We did that on March 10th. And so same thing as we move forward, we want to give kids every opportunity we can. But if the metrics say, listen, we can't play games, we have to go back to low risk activities, then we're going to advise that, and that's where we're going to go. If the metrics say, it's increasing too rapidly, we have to shut down, then that's what we're going to do. And within our fall sports plan, we do have criteria for that laid out pretty specifically.
Glenn, can you comment on what some of these new strategies you presented today are that would make football safer? Some of the new ones.
Yeah, so Joe, as I said earlier, the face masks, the face shields, able to present that and talk to those strategies a little bit. The trying to put a definitive number on how many people would be on the sideline, how many coaches, how many players, talking about the maybe some designated areas as well, where if a kid needed to, catch their breath, take a mask off, would be able to do that. Looking at other strategies as well. Is there any recommendation to kids wearing gloves? Does that contact make a difference? And again, I put out there that we would also look at within our committee as well. Think about modifications where if it was determined that things like the kickoff or a punting situation put kids at more risk, because that's kind of a probably in football where you're making the longest runs, right? And So if we needed to modify something there to say, you take the ball at the 35-yard line, or you go 25 yards down the field and take the ball, those are all modifications that we can make to hopefully reduce the spread.
So if the epidemiologists at DPH come back on Monday or whenever and say, look, we've looked over everything you presented to us, it's interesting, but we recommend that you don't play football this fall. Is that it? Is it over?
Well, at that point, then they have again they've given us their feedback and their opinion on the new strategies that we presented to them today, and then our board needs to look at that information and and see what that feedback is. And again, from there, I think DPH throughout has been very communicative with us. So I would anticipate the feedback that comes back to us one way or another will be helpful in terms of being able to inform the decision that we make.
So you said you were going to follow the science, follow the experts, follow the metrics. But so if the science and the experts are saying don't play football, what other factors would affect your decision of whether to play football?
Well, again, I think we've made clear as well. There's quantitative and qualitative aspects of that, right? So, and that's part of the things we've learned with COVID as well. And when quantitative metrics, support something, but qualitative theory, may have more concern. That's where I think it's important to provide as much education we can to our membership, and and listen to feedback and have people make decisions. I think it's what you're hearing. I think it's what you do right now, right? So even with things that are that are open in sports and in the private sector right now, I don't hear anybody coming out and saying if you come and play AAU basketball with us, it's 100% safe, right? You just educate people on here are the strategies that we're taking to mitigate it, and then you have the decision of whether or not you choose to come and join that activity with us.
So you would not rule out, Glenn, that if the recommendation is that we don't play in fall, you wouldn't rule out that the CIAC would still allow play and still put a schedule together for 11-on-11 football.
I don't think I could comment on that without first, really talking to the board and seeing what the feedback is that comes back from the strategies that we put forward. Again, my job and my position is to speak for the board, and we just haven't had that meeting yet with feedback from today's meeting, and I don't think we can answer that until that time.
The governor has the authority under his emergency declarations to basically shut you guys down if he wants to. Right? We saw that with youth sports in the early phases of this outbreak. Was that possibility discussed today?
I don't recall that in the early phases of that. I don't recall the governor ever shutting down youth sports. Maybe I'm wrong on that. Actually, the first entity in the country to shut down sports was CIAC. On March 10th, CIAC was the first group in the United States to shut down.
The governor imposed limits on the size of the number of people who gather outside, and yes, I believe in June, the reopening guidelines brought back the sports. So basically, regardless of that, whether I'm wrong, you're right, who cares? There was no discussion of an exercise of executive authority to basically say, no, you can't play.
The efforts on the governor's office have consistently been to provide as much support as possible to both CIAC and DPH to address the concerns. That I appreciate the efforts of the governor's office. Back in March, the decision was ours. As we move forward, if things need to shut down, I think the decision, to shut down would likely be again made by CIAC.
Thank you, Glenn.
Appreciate it, Tony.
Appreciate
Thanks.
your time.
Okay. Thanks, everybody. Appreciate it.